it's a personal decision. And at the end of the day, if you don't trust me and I tell you something that I think is going to benefit you, if you don't trust me, you're not going to listen to me. So I can't approach it with an element of shaming you to further divide that trust factor between us, or I'm just going to add to the problem, is my theory on that.
Welcome to In Good Company.
So I'm Katie Towns, and I'm the director of the Springfield-Greene County Health Department. I've been in this position for almost 5 years now. I stepped into the director position kind of in the middle of the COVID pandemic. So a little bit of baptism by fire. I was with the department, though, for about 10 years prior to the pandemic. And so we cover a variety of things in public health, and some things I'm sure you're familiar with, and then some things that I think people are quite surprised by. Other than that, I went to Missouri. I grew up in St. Louis and went to Missouri State for my undergrad, which is in sports medicine and athletic training. And then I spent a few years working in that sector, and then went back and got my master's in public health. And so the story there is that I never thought I would work for government, and I was in nonprofit. And the recession was hitting, and one of my instructors was the director of the department at the time, and he asked me if I'd ever want a job, and I said, no, thank you, I'm quite happy. And then the recession, really took a toll on positions, one of which was likely to be mine, and so I called him, and he had a position open, and I stepped in, and I've pretty much been with government ever since. So
wow, you gave it a try.
I did. And it was shockingly more exciting. The possibility, of working with policy and that sort of thing was way more intriguing once I was a part of it than I had the perception of. So you should always give things a try, right?
Yeah. Well, you mentioned trial by fire. So take us back to COVID-19, 2020, 2021, the pandemic. How did you get through it? What was your strategy day by day?
So that's a good question. I think, I had two small kids at the time. I had a kindergartner and a second grader, and I'm a single mom. And so when that hit and the orientation was that I pretty much balanced work, all of a sudden I was faced with, how do I deal with this pandemic, which is requiring all of my time? But also the kids were not going to school. And so I quickly had to kind of, I don't have family here. So I had to kind of navigate both of those real gripping sorts of priorities within my life. And we started off working nonstop. I mean, we were just in the office. Like, everybody has these stories about how they were staying at home and making bread and trying to find ways to not be bored. And they tell them to us, and we just kind of sit and stare like, okay, that's interesting.
I have PTSD from...
We were driving down the highway with no cars around us, going to work every day and just trying to figure out what we were going to do, step by step. But what we've quickly found too was working relentlessly like that was not going to be sustainable. And we also figured out not that far in that this was going to be with us for a while. And so we had to make internal adjustments within the priorities to really dial back and set boundaries on our work so that we could keep our folks employed and doing the work that they were doing, but also give people the ability to still do their life. We all had things outside of work that we were wanting to make sure that we attended to. And so, not that it wasn't easy, but it was just trying to daily find some of that balance. And, also I think the fact that we had, and that's one of the unique features of living in Southwest Missouri where we do, is that in Springfield-Greene County, even the surrounding sort of areas, we have this understanding of taking care of each other that is, it's pretty unique. And I grew up in St. Louis, so I have that different perspective, but we saw people really linking arms and for a long time staying in lockstep about different decisions that were being made. And that helped us get through because it was supportive and gave us an environment of feeling like we were all going to do this, weather the storm together. Things evolved and there were lots of opinions that came about different aspects of the response to the pandemic. But with the limited information that we had and how we had to respond so quickly without knowing all of the scope of information we usually have to make decisions, it just forced us to sometimes make decisions and then see that it was not the best, pivot, and then move on and make another decision. And so that took a toll for sure, I think, on me, on individuals, the community, in terms of lots of different aspects, but physically, emotionally, mentally. And so there were constant points in my life of trying to figure out what access to different tools and resources I had, and then using those things. And it forced us to ask for help and to receive that help and let people step in and be that sort of, supporting role that sometimes we as leaders, we're not too quick to open up to those sorts of approaches. So I think for me, it was a tremendous learning process, and it changed my life quite significantly. Some of it I would never go back to, but then a lot of it I think are lessons that I will carry with me. So
you mentioned boundaries. So what type of boundaries did you have to set going through the pandemic?
So you will be surprised by who has your phone number when you have information that everybody wants to know. And so all of a sudden, my phone just blew up with people calling and texting and asking for their situation. They wanted us to all weigh in individually on, well, what about my situation and how do I navigate this? Which in our roles, we're in service roles. So our inclination is, I want to help you. I want to be able to be that perspective for every single person. But it was overwhelming. And we couldn't respond to folks in that, timely of a manner, in a way that made sense. And so, I had to get to a point where at night, when I got home, I would put my phone away. I would turn it on Do Not Disturb. I took my email off of my phone. Things like that were just these limitations that if I didn't, I would be constantly, just clung to these little notifications, looking at me, thinking, and making me feel guilty for not responding. So it was some of those steps. And then it was also looking at systems. So I'll be the first to say that the public health system, we knew of some of the frailties, but we saw it all unfold and the breakdowns occur. And so we, being a local representative, were subject to some of the same frustrations that people had collectively. And we knew about some of those things, but you're also forced to sort of be in this role of figuring out what your priority is. Is it to maintain the structure up through the system, or is it to do what's sometimes hard and take the local approach, which is sometimes putting you at odds with folks that are, above you or in these different parts of the system that are at maybe a disagreement in how you're operating. So we had to put some boundaries in place with certain things like that so that we could keep our eye focused on our priority is maintaining our community. And that's what we're going to always be oriented to, sort of as our guiding light. So
jumping ahead years, so now we're in the present, what has changed?
That's a good question. So I would say there have been some things, that we have done locally, again, that have been lessons that we have taken from the pandemic and said, we need to be better at proactively creating this unified sort of bench that whenever we have something come up again that we're all faced with, we know that we have this group of people from across these sectors that are going to be unified. At least, if we plan for it and we reach this decision, then we all know where everybody's coming from. That in a lot of ways can be extremely helpful when you're forced to make decisions that are putting you in a tenuous sort of tight spot where you're going to make somebody mad, but everybody at least can know, hey, I know where your perspective is. So we have a group that we meet with monthly, and it's representatives, first responders, it's the hospitals, it's emergency management from like a more of a governmental role. We have state folks. We have all these different agencies that are looking at and planning for these different situations. And again, resources aren't really that much improved, but it's like we have built such strong relationships with this group of people that now when we're handling things like Ebola, that's become an outbreak that we're monitoring across the world. But for people who are entering our country again and are coming back to residence within our community, we have to be prepared. And so when we talk with these folks, we all know the different angles of the response and what things are going to be factors in the decision making. And that to us has been a huge help in us preparing for what is the next crisis or disaster that is going to strike. Because we all know something is coming. It's just when, we don't really know.
Looking at our community, what can people do at home now to kind of prepare for something like this again, a potential pandemic? I
think that's a great question. And I think that it's a hard one, because I think one of the biggest things that we can help people understand is that we want people to know about the threats and be aware. I think it's so easy because there's so much news all the time. Like you can consume information all day, every day. And it's hard for us as individuals to figure out, like, where do you consume? What do you consume? But to know that things like Ebola are real threats, that's just an awareness that helps our community stay vigilant and to stay prepared for. But another one is measles. Like when those outbreaks were happening across the country last summer, we were going into school systems and we were saying, here's what's probably one of the next things to come. We want you to be prepared with, pull out your plans and make sure that you're up to speed and you guys remember, because it's easy to put that stuff away and just not think about it, right? So we want people to have that awareness, and then to make sure that the information that you are consuming is good, strong, evidence-based information. That's another big thing in our world right now is, how do we make sure that the misinformation does not sort of overtake the information that is creating the most protection for people? So we do a lot of work to try and help people sort through, engage in conversations about that. And then to make sure that you are plugged into, like, on your social media feed or have those resources that you can access should something come up that you're going to need to get more information quickly. Then you already have, a list of trusted resources that are your go-to once that is happening in the community.
Well, let me just touch on that piece of it, because I think there's a lot, just like you said, a lot of areas that people get their information. Mm-hmm. Some of it's good, some of it's maybe not as good. And I think what might really help some of our listeners is just to kind of know, like, what are your favorites? Mm-hmm. Like, where are the places that you're going to go and say, I know I can rely on this because it's going to be consistent and, it's going to be reliable.
That's an excellent question, because that has even changed, and it's sort of evolving as we speak. So I will say that within the scope of information, one of the things that we do at our department is we have created a page, especially in the immunization space, that links to solid research that we have used in our recommendations and evaluations. And that's one of the areas that is changing very rapidly right now. We used to have CDC sort of as our guiding light. That has even evolved in terms of us at a local level, figuring out how to look at the information that is coming out and evaluate it to make sure that it meets standards that our department would say are reasonable and evidence-based. So we now are looking at things like drilling down into the actual study and looking for the components of how the research is set up and making sure that there are good, strong those sort of fundamentals in evaluating studies before we place them on our website. And so I would say, I mean, I know that sounds sort of arrogant, but within the scope of public health information, we at the Springfield-Greene County Health Department have created a site that provides the information that is more leaning towards evidence that has good, solid fundamentals in terms of creating a research process and actually executing it. On a variety of different things, though, in terms of communicable disease, I would say that we are always going to have to defer to certain information coming down from that federal level of the CDC through the state and to the local level, because there are proprietary sorts of pieces that only that level of government will hold. And so just like a counterterrorism sort of approach, this is considered a disease. It could be, a potential crisis for a community, for our nation. So they have sort of a stronghold on those pieces of information. And so we always have to have a conduit that connects us to that so that we receive that. But then we look for other evaluation from, like, for example, an infectious disease doc here in town that we're bouncing this information off of so that we don't just say, oh, yeah, we're going to take this information, and not question it at all, but then use it to make decisions. We're taking information, bouncing it off of that group that I talked about and their different perspectives to make sure that we're using it in ways that apply to the best strategy for our community.
I don't think this is a new thing. Distrust of government is kind of we have a long tradition of it in the United States. And, some things have been founded in some ways, like, I think, even with the polio vaccine, when it came out, they had a batch of it, I think about 200 units that ended up causing polio. And there was a big backlash right after that came out in the 50s. And then it was in 1976, they had I think it was one of the soldiers came down with swine flu, and the government really wanted to go, thought there was going to be this big outbreak and really pushed for that. And it didn't come, that sort of thing. They're like after 9/11, they were really, pushing the anthrax vaccine. There was some pushback on that. And, those are hiccups in the whole scheme of things. And the number of people that have been saved from vaccines is, it just cannot be doubted.
Right.
But there's still this politicized faction out there who are really and to be honest, there's this push and pull because there is a lot of money.
Yes, absolutely.
Being played around and a lot of companies that are in it for the money. And so, I think as much as somebody could simply look at somebody who's skeptical of our government and go, they're just, they don't understand, they don't have the information. I kind of can understand why they feel like that sometimes. Absolutely. Because I'm trying to put myself in their shoes. Some of them have lived through some pretty bad situations where they've been lied to straight up. And, and so it taints the good that's being done or has been done, and especially around public health and getting people vaccinated. And, I wonder like how you balance that out when you're out and talking to communities and there's people sitting in your audience that are probably either skeptical or, maybe completely, anti-vaccine, and, you're trying to reach them to help them understand that, that not all vaccines are bad. Mm-hmm. There are good vaccines that don't cause side effects, and that, them and their family can really benefit from it, and that the alternative is not good.
Right. It's a tricky balance. And I will say, I think, growing up, that was something that we didn't really have that when I was a kid. It was just, you went to the doctor, your mom took you and you got your shots, and then you went to school. And so I think we've kind of come into this evolution, and you're exactly right. Vaccines have saved lots of lives. And we sort of in this room, and many people, we've sort of benefited of the comfort that some of these things have provided. I am not a person to sit here and say everything is perfect. It's not. Science is not perfect. And it's sort of been largely misnamed, I think, in that way that, research is going to tell you exactly what you need to do because it's going to give you this understanding that sort of provides the justification for doing this act. Well, that's not what science is. Science is an evolution. It is constantly teaching us how, and looking at it from a new perspective to figure out how we might do something better. So immunizations as a collective whole helped us to progress to not die from things that were killing us once, because things like tuberculosis. I mean, that's why the health department, one of the reasons it was formed back in 150 years ago, we don't have tuberculosis killing people any longer. And so we've been able to, to mitigate that disaster. Things like measles, people haven't had to suffer of the, children have died. Children died in the last couple of years because they suffered from a measles infection. And so what we hope is that we bring the message of, it's not a perfect solution, but it largely is going to benefit people who take in the recommended dose. Yes, will there be imperfections? Absolutely. Where you get your information, though, is another big part of this process, because there was evidence, when I was younger, prior to being in the public health field, that was attaching vaccines to things like autism. And that has since been debunked, but there are still these strongholds of belief that have helped to sort of move us in the direction of people having so much fear that it is causing the decline in the uptake of things that can be helpful. And so we don't approach it with, it's a must, it's you're wrong, I'm right. That to me is destroying that element of trust and credibility that we should be trying to always build. It's a personal decision. And at the end of the day, I'm not going to be able to, if you don't trust me and I tell you something that I think is going to benefit you, if you don't trust me, you're not going to listen to me. Mm-hmm. So I can't approach it with an element of shaming you to further divide that trust factor between us, or I'm just going to add to the problem, is my theory on that. We are firm in what we state that we believe as recommendations, and with the justification that we use to support that. But we don't, on an individual level, take the approach of trying to figure out who's right and who's wrong when it comes down to individual decisions. That's just not, it's a philosophical thing that I think that our department has sort of taken, because we spend a lot of time doing work in the space of mental health. And so the thing that we're not going to contribute to is worsening that trust relationship with our community, which is not improving our mental health either. It's, we're in an evolving sort of space in our time. And I think it brings with it this opportunity to figure out how we can better understand each other and look for ways to bridge the gap rather than to divide.
I'm a physical therapist.
Okay.
And so I've spent my career, working with older adults. And I actually have had 2 opportunities to work with post-polio.
Yeah.
And actually just ran into a gentleman, not related to PT, but just in passing, that had polio as a child. And, the nice thing about being a physical therapist is you get to work with somebody for a long period of time. You see them multiple visits and that sort of thing. And I was fascinated by some of the stories that they told and how terrified, especially parents were sending their kids to school, wondering when their kid was going to get polio and be on an iron lung. I think there's some people who don't even know what an iron lung is. But it was such a debilitating disease. Right. And so when, the SARS vaccine came out, everyone was so just clamoring for it because they, as a society, they were just terrified. And I hate to say it, but it seemed like it was because it was kids.
Right. Oh, it's worse when it's children that are suffering. Yeah.
But the pandemic that we just went through really hit the elderly population. And it felt like that didn't seem to have the same impact for a certain, segment of folks. And I often wonder, I was like, if COVID-19 had targeted children and infants, if our take on things would have played out differently.
Yes. We had that conversation a lot during that time period because you're absolutely right. We are more sympathetic as a society to things that make children suffer. And so I think, unfortunately, that cultural issue of, people who had comorbidities. It was like we didn't even have that sympathy for people with comorbidities that were suffering. It is a fascinating sort of factor within our culture right now, but I think you're spot on that did not seem to play out in that way, that it affected children. So we just seemed like, well, adults can make their own decisions. So they get to do that, and that was sort of more of the approach.
Yeah. So just curious, and because I have no idea the answer to this, but like in a school system or in an area, how much vaccination needs to happen to avoid an outbreak?
So it's different for each disease that we vaccinate against, and sort of overall, though, what we like to see is vaccine rates above 93 to 95% across the board. Over time, we have been slipping. And currently in Missouri, I think our vaccination rate hovers around 90% in school-age kids. So there's a vulnerability there, which is why, last summer when we were hearing about measles outbreaks, we were making appointments with all of the school districts to go out and say, hey, this is something you all need to be paying attention to, because if you have a case within your school, the thing that we were talking about with them is the exclusion period for measles is 3 weeks, not just, this, 10 days or whatever. So that changes everybody's lives. And that's one of the things too, with all of these prevention mechanisms. We want people to know up front, like if we come to you and we say your child has been exposed, you have to be staying at home with them, not going to work, them not going to school. So we just want people to be aware, because then when that incident happens, it's not like they haven't heard this at all before. But yeah, I mean, there are tons of vulnerabilities now because of this rate slipping. And I don't think, quite frankly, we've seen the sort of bottom of that. I think that some of that comes when we have outbreaks occur in schools, unfortunately.
Yeah.
Because that's how we learn. As a human being, our learning a lot of times is by living. So that's how I think it's going to sort of play out.
We'll return to this podcast episode in just a moment, but first I have to ask you, please like, share, and subscribe to the In Good Company podcast on YouTube, Spotify, and Apple Podcasts. It goes a long way to get this episode and others into the feeds of people who want to learn more about general wellness and aging better. And now back to the show.
I'm just curious too, because I got chicken pox when I was 12.
Yeah.
And it just about killed me.
Did it?
Yeah, it was the middle of summer, and I think I was like couldn't get out of bed for almost 3 weeks.
Yeah.
I mean, I literally was crawling to the bathroom. It just really knocked me hard because I was so much older, I guess, that my immune system wasn't really prepared for it. And I'm kind of curious, like, for some of these kids who aren't getting vaccinated, if we're looking at a much more serious outcome as they get older.
Yeah, that's a really good question. We have a lot of young folks that are unvaccinated right now, but sometimes that's a benefit. But in some of these disease conditions like measles, I mean, it's better if you're older when you get that than it is if you were younger. And so we're super sensitive to things like, one of the big things that vaccine can do is to help protect babies. So when you have an outbreak at a school and, your family at home has an infant, like that can be extremely severe for a situation where an infant contracts a condition like measles or something else, respiratory. So yes, but I don't know that we have seen fully some of the severity that will come from people who have never received vaccine, and then contract a disease state like that in their adulthood, because we just don't have that data even to
because everybody got vaccinated.
Right. Mm-hmm.
I know when I was young, that was just normal. Like nobody ever questioned it. It seemed like.
Yep. Absolutely.
So it seemed very new to me when this kind of all came about during the pandemic.
Yeah.
So.
Us too.
Yeah, I bet. So what do people not know about the health department?
So I think, I think people are constantly surprised by the variety of things that we do. So within the health department, we obviously do disease investigation and try to mitigate spread of disease, which people became very familiar with during the pandemic. But the things behind the scenes that I think they understand that we did that with COVID. I don't think people understand that we do that for over 200 disease states. And those are in a statute at the state level that we have to investigate every one of those diseases when it is diagnosed inside the healthcare system. And so we have a team of epidemiologists, and all they do all day long is receive reports that are diagnosed in the hospital, are routed through the state for reporting up to like the CDC and to keep a monitor on a state level. It comes back down to our department, and then they reach out and establish that sort of questioning process to understand the history, where they might have contracted, and then any people that they might have exposed. So we do that ongoing, and it overlaps into the space of we do food inspections for all establishments that are serving food. And we do that primarily to control disease outbreaks. And so foodborne illness is a real thing, and it is hard to track at times, but we also, the association, But we know, and I do feel like that is one of our strengths in our country, is that we have a very strong mechanism of tracking food from distribution through the system of it being consumed. And so we're constantly monitoring for recalls that are coming out and going out to grocery stores and helping to make sure that they pull that food off of the shelf so that it's not consumed. We run the WIC program, so Women, Infants, and Children, which is a program that has been around since 1976, and it's a supplemental program for moms, babies, and young families, which is something that I was a WIC baby, and my mom tells me all the time, because now that I'm in the health department, she's very excited to tell me that I was a WIC baby. But that's something that's extremely important, especially with the cost of groceries right now.
I was in college with my first son, and he was a WIC baby because we didn't have the money.
Absolutely, and it provides a really nice help for that time period, especially, babies are just expensive, right? Yeah. And so, we all know. And so we run that program.
Really well.
Alex off camera, by the
way. We also do, we run in Springfield, we run the animal control program. So that has received quite a lot of attention lately, because one of the things that we do that for is to prevent rabies spread. And people are constantly surprised that rabies is still a thing out in the wild, but it is. So we run that. And then we also have a lab on site. So when COVID was happening, we actually used that as an asset to stand up testing within our department. So that was something that was a really big strength for us. We do water testing for the county, so for people who are using well water. And then within the space of chronic disease, because as our culture has evolved, communicable disease is no longer as big of a threat, but chronic disease has become a huge threat. And so we have worked on a lot of things that are more related to several years ago, we put a tobacco 21 policy in place to prevent young people from starting to use tobacco and then become addicted before they're age 21. And then we started looking at mental health and substance use prior to the pandemic, and really started to dive into that as an issue that is extremely prevalent. And I don't think it's gotten better that we're talking about it more and that we're uncovering this information, but we haven't quite hit a stride in being able to really combat that as a societal public health concern. So those are things that we as a department are picking back up and getting ready to explore further, that I think are some of the other things that people might not ascribe to a local public health department being in this space of mental health.
Can I ask you, what are some of the initiatives around mental health that you're focused on?
We started this back in 2019. We commissioned sort of a deep dive into our community to really learn more about what the mental health concerns were most pressing. And we came to some data that showed us that within the healthcare systems, they were receiving a lot of that traffic where people would walk in either through the ER or they would go and become admitted because they were suffering from a mental illness. And so things like major depressive disorder were driving a lot of hospital admissions. And through the ER, people in mental health crisis were walking through the doors and being, evaluated and treated and probably released, because that's not the ideal location for people to be treated for their mental illness. And so when we sat down, we asked the hospitals to be a part of this study and looked at their data set, and they were very gracious to lend that to us. Our consultant analyzed for us, and we came out with some really interesting things. One, We have a suicide rate, unfortunately, that is higher here than the state of Missouri and the entire country.
Wow.
Specifically, that is higher. Men are dying by suicide at a much greater rate than women are, and specifically men over the age of 45. And so that was one finding. I mentioned the ER traffic. We also learned that there's not really a great place for people to go if they know they're in mental health crisis. Like the ER was the only thing available. So people were going to that. We actually, after those sort of findings came from this study, we did a big announcement, and then we had some folks come to us and say, hey, including the police department and Burrell Behavioral Health, who's now Centerstone, but they said, we've seen this model in other places where there's basically an ER and a crisis center for people who are in mental health crisis. And so in Springfield, we opened with them in partnership with, it was a public-private partnership to begin, and then Burrell took it over. But they run a facility where people can go and be admitted into a 23-hour stay to stabilize their mental health crisis, and then be moved to a facility where they can treat. So maybe it's an inpatient setting, maybe it's an outpatient setting, maybe it's just getting them plugged in with a counselor who can see them regularly. But oftentimes, if you're not in a facility like that, calling up a counselor to try and get in, it could take you weeks. And so they're able to get sort of a path straight to somebody that can see them right away. So we've helped to kind of offload some of that traffic. And actually, we've had traffic there from not only Southwest Missouri, but from Kansas, Oklahoma, and from all parts of Missouri, where people have come because they've heard about this. Since then, there have been a couple of, I think there was one opened in Columbia, Kansas City, and I believe St. Louis was even looking at one. So it's a model that was, I mean, I'll toot our horn, that we really sort of brought to Springfield and then said to other folks, yeah, go and replicate because the need is out there. And then to speak to that issue of suicide, what we did within our department is we worked with Community Partnership of the Ozarks, and with a grant from Community Foundation of the Ozarks, we created a campaign to generate some awareness around that issue. And it was called Hey Man, You Good. And it was a campaign that was developed by men in that age category that told us, what do you want somebody to say when you are feeling like you need to talk to somebody, but you don't quite know how to start that conversation? Because the stigma is real, and we all probably know it and feel it. But when you're in that moment where you're not quite okay, but you don't know how to say the words to get the help you need, what can somebody say to you? And the response that they came up with was, hey man, you good? And so we really promoted this idea of men checking in on men. And so that has been another sort of component from the health department that I think people aren't quite aware of, that we are trying to step into that space and make sure that the resources are there for people who are going to seek them.
Yeah, we had a guest on not that long ago, Kevin Weaver. He was with Warrior's Journey, and he talked a lot about how like needs to be with like in order to help, and how important that is to, especially we, this podcast is about trying to help people who are getting older, and the process of getting older and dealing with all the stuff, because it starts to snowball.
It's not fun.
No, it's not. And, one of the big things that we look at pretty hard is the social isolation aspect. And as people get older, they sometimes leave their careers, families get busy, that sort of thing, and how that impacts their overall physical health. Right. And, it seems like as we're doing this podcast, we're kind of weaving through and seeing aspects of it where we had the CEO of Victory Mission on, and he was talking about, over the age of 55 being the fastest growing homeless population. And, that being somewhat related to, the mental health issue. In our area, we're in home health, hospice, and home care. And we see this a lot in the older adults because we're going into their home, and it's kind of the same thing. Like they don't have a lot of social interaction that would help them thrive. Yeah. And so you really speak to, I think, a broader issue is that I think this problem is growing very quickly, and I honestly think. There's just not enough said about it. Our older population is going to be struggling, and we talk about 5 pillars here to try to help people stay, healthy and have a better quality of life. And that's, have a better home environment, medication management, nutrition, hydration, exercise, and social connection. Mm-hmm. If we've got those 5 things, we've got a lot. Yeah. Like we've really covered most of our bases. But I would assume that, you've got so many things that you're trying to cover. And what other, agencies out there that kind of walk in step with you that you can kind of go, hey, you take this, we'll take that sort of thing? Are there other agencies out there that you're working with?
Yes, thankfully. And Kevin Weaver and the Warrior's Journey is one that we've been quite connected to. And they're doing tremendous work, especially in that space of veterans. And that's another, I think these underlying themes of it's the social isolation, but it's also that emotional isolation that so much sort of provokes this behavior of one of the stats that we found in our study is that 50% of men will state out loud that they have thoughts of suicide, but that same group is saying they're not seeking help. They won't seek help. And so that stigma and destroying that so that we can have these conversations so that people that social connection component is an antidote. But if people don't feel like they can use that or receive the help that is offered through these different mechanisms of connection, then I feel like it's sort of like we're hitting our head against a wall. And so we are working with both hospitals on this, with Centerstone, but also agencies that have sort of what I'm intrigued with is these nonprofits or these groups that are really sort of coming from the ground, and they're looking at these issues from the aspect of what's happening in our schools, what is happening with the dad that doesn't know how to connect with his child, or in the marriage that isn't quite okay. How do we really help these individuals? Because sometimes when we get into the corporate, it sort of that individual interaction tends to get a little bit lost. And so we are working with agencies like Good Dads and Borrow My Angel, who I'm not sure if you're aware of them, but they're another nonprofit in Springfield that Chuck Dow started, and he had a sister who died by suicide. So he started this nonprofit because he's experienced that loss and he doesn't want other people to suffer without somebody right next to them. And so we have been working with those groups and are also then working with folks like first responders, firefighters. And it's like, they're the ones going into these crisis situations, but they see the moment, but what we're trying to do is engage in a conversation to find out what are the themes, what are you seeing that are the underlying factors that seem to show up in every single situation. That's where we as an entity can start to combat and to say things out loud. I think we've been, just this mental health conversation and that's where the bigger partners being involved helps, when we have Cox and Mercy and Burl and all of those folks lined up in a room saying, we all need to talk about this, it sort of helps to normalize that issue. And then the individual groups really can get in there. Good Dads is in the schools, and they're creating these places where it feels safe for dads, men, to come together with their children and have a morning where they just spend time playing games together and connecting. That combats the social isolation, the emotional isolation of feeling like, I don't know how to do this. And so there are these lovely sorts of these sort of groundswell of things that are popping up that start to help a fabric come together. That, to your point, you do this, this group does this, and we start to weave that together. So one other thing I'll say is that we are starting, I mentioned that the last time we did this deep dive was 2019. We have some funding set aside right now that we're going to be pursuing a follow-up to our study to really, the pandemic changed everything, right? And so we know that mental health became much more exposed during that time. And we want to know, what does it look like now? And what are the needs? Are they the same? Have they evolved and changed? And what do we need to do in a way that makes sense, that we can offer something that is more community oriented, but gets at the heart of the issue, which is in individual interactions.
It's so good. We here at Haven, we started this a long time ago, where we started covering copays for therapy if somebody needs to go seek therapy, just because. And I've been really open with my people that I've done therapy in the past. I've gone through some things here and there, and that it's okay.
Absolutely.
Like it's okay to talk about what's going on with you. And I think I think the younger generation maybe are a little more comfortable with, especially the guys, seem maybe a little more comfortable talking about their, what's going on with them. Whereas my generation's a little more, just wasn't done, and they're a little more locked in. And even the generation above me is even worse, So it's a tough crowd to reach. It is. For this mental health part of it, because, I think, unfortunately, the way it was posed to them was that it's a moral weakness. Right. And, and to be honest, some of these guys have trust issues, serious trust issues, and sometimes they're well-founded. Right. And so, it's understandable why they might be a little standoffish.
Shy about that. Yeah, absolutely. And I commend you and hearing men say, I've done therapy. I think that's it's not only just okay, it's super courageous. And I commend you for saying that publicly and being very open, because that helps give permission to folks that you might not even realize. Like that sentence is such a powerful factor in really changing the trajectory on that stigma associated with getting help when you need it. We all have our things, right? And I think as a female, I have the permission to say very openly, like, I went to a counselor, because people they sort of categorize women as, you're emotional. Well, yes, but I'm also, I also run a health department and I run a household and all those things. So it's like but you have moments, right? Where life is life.
You not only run a health department, you ran it through the pandemic. The first thing I wanted to ask you is like, are you okay?
Gosh. You mentioned Tobacco 21, mental health access. Yeah. What have you learned about moving a community from awareness to actual behavior change?
That's hard. So behavior change, I remember taking that class back in, I think, my undergrad and my graduate work. And, you learn about how do you make behavior change? And there's like this stepwise process. But then you get out and you get into the real world, and the application of it, it's like, that's just out the window. You can try and all you want. But I think that's where, for me, sort of some of my own suffering and my own, I've suffered from anxiety at many points in my life, and I've received treatment for it. But I think that the biggest learning for me has come from these moments that have been so painful that it forces you to change your behavior. And so that for me, my personal experience somewhat frames my philosophy on behavior change. And I think that individuals who experience, mental health crisis, it completely changes your lens so quickly, because when we have heard the stories, sat down with people and had them share with us their struggle of either themselves or their child, their loved one who has gone through this process, it's like beforehand, you just go along sort of thinking life is, just going to be what it is. And then something like that happens and it changes your whole frame of reference, and your mindset becomes, how do I prevent that? And I think that's really where behavior change in this mental health space has opened up some opportunities, because as we see suicide rates increase, that means that more people understand, unfortunately, how painful that is, and then can share, maybe the hope that they see for helping to intervene at a point that might have changed that direction. But within other things like Tobacco 21, sometimes it's things as meaningful as a policy that helps to break that chain. So the reason that we passed that is that we found out that through evidence, if a young person begins the use of tobacco before the age of 21, their likelihood of being a lifelong tobacco user goes up exponentially. So that policy was created to sort of be a sever that helps to prevent that addiction from happening and get them sort of bridge through till after the age of 21, where if you make that decision, maybe you're a little bit more, your brain is a little bit more developed and you're not going to be as susceptible to the addiction that young. So policy has been a big one. And that's why during the pandemic, as much as people were angry at us for many of the policy decisions that we made, policy, again, is not a perfect science either. It's a sort of an intervention to be used to create behavior change. And just like seatbelts, once, that was the law, people started using seatbelts and lives were saved. So that's a policy piece that really helps to change behavior that saves lives. And so I would say it's like that learned living of suffering and sort of opening windows, and then the policy that we use as our sort of primary ways of seeking ways to help improve behavior.
When the pandemic hit, we're a healthcare organization, so we're, it's all hands on deck. And, we're kind of the relief valve for the healthcare system at the time, because there was, that they had people who were in the nursing homes, they were kind of locked down.
Yep.
And then we had these folks that really needed to get out, but, some of the clinics may or may have not been up and going. And so we just started getting orders left and right for people to see them in their homes. And I remember at that time, we just couldn't get supplies.
Yeah.
We just couldn't do it. And so I was driving all over the state of Missouri and into Arkansas, going to paint stores for N95 masks.
Yeah.
And, we were having, I was getting big things of alcohol so they could try to, sanitize them and make them last longer, and that sort of thing. Do you know if another pandemic hit that we've got, those essentials ready to go?
Yeah. I wish I could say with confidence that we do, but I don't. Right now, I don't believe that we would have that. I think we would have that same ramp up of a supply chain sort of being, at the mercy of the need to put into production the PPE that was needed, or the whatever other elements of a response that you were going to require.
Well, I will start hoarding now then.
Good. Yeah. We have some extra still. So we ended up like, that was the hard part, is like you didn't have enough at the beginning, but then it just kept coming. And so then now we have like storage units full of PPE.
I know. I had cases and cases of full body, suits and that sort of thing. And it's like, I just needed the mask. Right. That's what I really needed. I just needed the mask. But it's good to know, because, honestly, that actually might be helpful, in this area, especially to let providers know that, it might not be a bad idea to keep some of this type of supplies on hand just in case there is some sort of outbreak. Because I think I assumed that, from the first experience, that the government was going to step in and have, cases in a warehouse somewhere ready to ship out to all these providers. Because at the time we were all begging each other for masks. And I remember finally when we got a hold of them, I took a bunch to my dentist because they didn't have any. And, it was just one of those things where, you just don't know what you need until you're in the middle of it.
Absolutely. That's the hard part on that scale too. Because the rate of burn with that PPE was the other sort of unprecedented part of that pandemic that just nobody anticipated. So those are the hard parts.
Yep.
Yeah.
You mentioned a 2019 case study. You're having a case study right now.
Yeah.
What are those numbers you think going to show, and where do you think the health department needs to go in the next 10 years?
That's a great question. So I think that, the good news, so when we did the study in 2019, the other thing I didn't mention previously is the overdose rate was extremely high. And we were in sort of that peak, or heading into the peak. I think we peaked in 2021, 2022. Those numbers have started to stabilize and come down. And that, I think, is in a large part due to distribution of naloxone. So people are able to not have, or are able to recover, which is saving lives, which is wonderful. On the other hand, I think that we have seen the suicide rate has probably not, I'm going to guess it probably has not changed in the trajectory. So I am super interested in what we can do more on a community level to, again, go back to that conversation of how do we make this more normal for people to discuss, to have this recollection of the fact that we are all human. And when we come into work and we are doing, the daily life, the grind that is overwhelming on many days, how do we allow ourselves better tools to be able to intervene for not only ourselves, but for each other and on a community level? And so I don't think that we have really grasped that yet. And I think that there's ways that we can better understand what the needs are in schools, for parents, I think for employees, and we mentioned first responders, but they're always in the middle of these crisis situations, and they make up a strong segment of our families as well. And so they're taking their day jobs and then having to deal with the weight of that at home. And not just first responders in terms of like our firefighters and police, but also our healthcare workers. I would include them in that whole category. But life is, particularly combative a lot of times now. And so that to me is a strong component of why we all suffer from these mental illnesses and these mental ailments. And so how we can reframe that understanding for one another, for ourselves, I think is going to give us insight on how we can intervene and do things that are going to make sense to improve that in the future.
That's great.
Yeah.
I mean, it really is. It's really, really good. And I appreciate the work you do so much. How do people reach your organization?
So we have a website, and you can just Google Springfield-Greene County Health Department and it pops up. We are also on all social media platforms. So we have Facebook and Instagram, and I don't think we use X any longer, but LinkedIn. So we're pretty available through those options. And then if you forget about that, then you can reach us through the city of Springfield as well. So we're eager to help. And if there are any questions ever, you can feel free to reach out to, we have a sort of general line on our general email address on our website, or you can reach individuals within our department as well. So,
awesome. Well, thank you for the work you do, the leadership. And when I think about the pandemic and going through all that, and the last place I would want to be is in that particular position at that particular time, that you stepped into it knowing what you were like, standing up for trying to help people and be a rock to people when people were scared and a lot of unknown and that sort of thing. And so thank you so much for that. I really do appreciate that. And thank you for coming on the show today.
Thank you for having me. I really enjoyed it.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.